That's why it is difficult for them to again revise those basic clinical subjects. So mostly the marks obtained in this category, clinical science or clinical basic medical science, is quite low. Other than that, people also faces difficulty mainly in the neurology. You can see here there are 14 questions that may come in the part 1 examination from neurology, and people usually have difficulties also in this specialty as well. Other than that, if you go and study accordingly to your plan and in an organized manner, it's quite easy to score very good marks in the other specialties here. Now this was for part 1. Then once you pass part 1 examination, you become eligible to go and sit for the next examination for MRCPs. And there are 2 more examinations. One is your part 2 written, and the other one I have already discussed is called PACES. Now, you can sit for any one of them according to your comfortability, according to your preparation. It does not have to be written first and then clinical examination then. It can be in any order. That is one advantage. So it's not like that you have passed part 1 and then you have to go, must go for part 2 written examination and then only you can go for PACES. It's not like that. If you're comfortable and confident about your practical skills, you can directly go for PACES, and after passing PACES, then you can sit for the part 2 written examination. So for part 2, as you see here, mainly the eligibility is that you must have passed part 1 examination. Do remember that the validity of the part 1 pass is only 7 years. So you must have to sit for part 2 examination or the PACES examination within 7 years of you passing the examination. Okay, you must appear in the part 2 examination. Now part 2 examination is a bit more complex. It's not as easy as your part 1. Why? Because part 2 will be, as you can see here, will prioritize in the diagnostic, will prioritize in planning of investigation, prioritize on selecting a plan for immediate management or long-term management, as well as assessing prognosis. Keep in mind that in part 2 written examination, there will be no basic medical science involved. There is no basic medical science which we were having in part 1. We don't have it in part 2. There is no such thing. So part 2 is solely related to your clinical experiences. So it will judge your ability to properly diagnose a case and how you manage this case and how you assess the prognosis of the patient. That is what basically part 2 is made up of. So similarly, part 2 is also made up of 2 papers, each 3 hours times, and held in the same day. Similar like part 1 examination, part 2 also each paper will have 100 multiple choice questions. And the major difference between part 1 and part 2 is that part 2 will have images as question. So it includes several ECGs, around 5 to 10 ECGs question. It will include your CT scans. It will include ultrasound and any other images such as flow, for example, such as flow cytometry, and as well as any kind of radio diagnostic images that you have will be included in part 2. Last one that we have in MRCP is the PACES one. Now, usually people, when they pass part 1, they usually go to part 2 written and then they go for PACES. However, there are exceptions as well. People who just passed part 1 also somehow sit for PACES. As I have told already, if you are confident enough, you can sit for PACES. Now, PACES examination will only take place in certain designated examination venues. So, for example, in India, we have certain venues, in Arab countries we have, and also in UK, we have centers for PACES. Unlike part 1 and part 2, PACES does not take place in any venue. They have specific venues for PACES. And usually it's a hospital settings, because you will be tested with the help of patients who are admitted in the hospitals. Okay. Now in 2020, there has been some changes for PACES. So basically, PACES will include a half-day examination, will take place in a clinical setting, usually a hospital, and mainly check 7 of your core skills. In 7 core skills, you will encounter 8 patients. And for each station, there will be 2 examiners. Each candidate will be assessed for 10 minutes or more, and in total by 10 examiners. The changes that have taken place in 2020, if you see this diagram, you'll have a better understanding. So as we have discussed, there will be changes. So now there is no more 7 stations, okay? Rather they have changed it and converted into, as you see here, station 1, station, in total 5 stations we have, okay, that have been made available instead of 7. Station 1 basically will include your respiratory system examination and abdominal examination. After station 1, you get 5 minutes of interval, and then your history taking capability or skills are checked in station 2. Again, you will have a 5 minutes interval, and then you go for station 3, where you will be checked for your cardiovascular skill examination and neurological examination. At station 4, very, very important, your communication skills and ethics are checked. This is the station where many of the candidates loses marks due to poor communication skills and ethics. This is the station where majority of the candidates will fail. Do remember that if you fail in one station, it means you fail in the whole examination. Okay, you need to pass in each station independently and individually. The last station that we have is regarding clinical consultation. Okay, you will give brief clinical consultation to your patient. So basically, these are the 5 stations that will comprise your PACES. Now, once you have cleared PACES, then you will get your degree of Mrcp UK. However, I'm telling again, those who are fresh graduates, okay, they should not proceed. I mean by fresh, you have just passed, let's say you just completed your internship, they should not proceed with Mrcp at this stage. At least they should get 24 months of clinical experience. Okay, enough about the examination. Now let's check about what study materials to use, because there are so many things to know. First important thing, there is no use of Davidson, there is no use of Bailey, there is no use of your conventional medical textbooks that you have studied in medical school. If you go through those material, okay, then it will be a blunder. If you go through medical textbook to prepare yourself for this examination, it's a blunder. The most what you can go for is that, okay, you can take the Oxford Handbook of Clinical Medicine as a reference. Oxford Handbook, it's a pocket book, okay, you can use that as a reference. But the main study material that we have for Mrcp 1 and 2, both of them, are these 3 notes. These 3 notes are very easily available in Google for free to download. Okay, number 1, the only notes you will ever need. This is a 500-page note. Okay, I have used this one, and it's for those who at least have moderate level of knowledge in medicine. Moderate level, I'm telling again. For those who have moderate level of knowledge, they can only use this book and go for Mrcp. Number 2, step up to Mrcp. This is the one that is, the writer name is Mrcp. As you can see here, it's a very famous book, very useful. This is for someone who have a knowledge between basic to moderate. Some of you who have moderate knowledge of medicine can use both of these. This is the best book. Among these 3, I would advise you to use this one, the best book, Mrcp. The last one is quite popular nowadays. It's something called Notes and Notes by Hamad. Now this book is huge, humongous. If you go for Mrcp part 1 and you study this book, you will be lost. So I don't advise anyone to use this book. Yes, you can use it only for part 2. If you are preparing for part 2, then you can go for that time, but not for part 1 MRCP. It will be again a blunder if you use this one for part 1. Now, only this study material is not enough to pass this exam. The most important thing, okay, and this is the thing where you will need to spend some money, is to use the online resources. We have 3 online resources option for MRCP. Number 1, Pass Medicine. It's a must. When you practice or you go through those notes, just now I have shared, you can practice all the questions. They have around 5,000 questions in Pass Medicine where you can practice, and this is must for to pass the examination. Trust me, practicing these questions makes you so confident, and it will make you so much easier for you in the day of the exam. You have no idea. So subscription in these Pass Medicine is must. Second thing, you can choose one of these, either Pass Test or BMG on examination. Now you may ask me why one is not enough, because you'll see if you go through only one of these online resources and if you go for the examination, it will be more like a gambling. It won't be a wiser decision. It's better to have a combined online resources always. Many people have gone only through one and then they have realized that they have done a big mistake. So among these 3, this one I would say Pass Medicine is a must to have. You must have Pass Medicine. Then the second option, you can either choose from BMG on examination or Pass Test. Among these 3, Pass Test is the most expensive one. But also there's a reason behind it, because Pass Test is also have the most number of questions in their question banks. So if possible, other than Pass Medicine, go for one of these online resources. Now, there is a spoiler alert. There are certain bookstores who are selling these question banks in a, what do you call that? In a book manner, like in a hard copy manner. Please do not buy those books. It will be the greatest mistake, because these bookshops are scamming people by producing these books every year, and by just changing the year name 2020, 2019, but they all have old contents. You see, for UK health system, the guidelines for treatment, the guidelines for diagnosis, management, it's very frequently updated. So you will know that which treatment to give only via if you have online subscription. So you must have a credit card to do subscription of these online resources. I'll just give you one example. When I gave the exam, there were many of who have studied hard copies of these online resources. They did not have online subscription. So they did not know the current treatment we have, options we have for your COPD and for asthma. So they chose the old options because they were not updated according to the guidelines. And so they lost their marks in that. So these are our online resources that you can use. Okay, now let's go to PLAB. Now for you who are very young, who have just graduated MBBS and who aspire to work in UK, I will tell you to go for PLAB, because it's way easier than MRCP and it will be the best choice if you want to work in UK. PLAB is the best choice for you guys. But I'll come to the but later on. Let's first see what is PLAB 1 here. So PLAB 1 will basically assess your knowledge, how you apply your knowledge towards your patient, okay? How you manage your patient, and mainly what is, as you can see here, defined as best practice in the UK. So you should be able to answer or know that how the management is done in UK hospitals. That is what PLAB 1 will basically look for. In PLAB 1, mainly you'll see here covers the common, important, or acute conditions. Only these contents will be assessed, and it will consist of 180 multiple choice questions, okay, and you have 3 hours time to answer all of these questions here. This is your PLAB 1. PLAB 1 can be taken in many countries. As long as you have a British Council in your country, you can give PLAB 1 very easily. However, PLAB 2 can be only given in UK. No other country, only in UK. So after passing PLAB 1, you will need to get the UK visa, which you will get of course if you have the letter from the PLAB authorities, and then you can go for PLAB 2 in UK. PLAB 2 is basically your OSCE examination. That is your clinical skill examination. They will check your clinical skills basically in PLAB 2. PLAB 1 is written examination, and PLAB 2 basically you will be checked about your clinical skills. Okay, so what kind of clinical skills basically is checked? You see here the whole exam takes around 3 hours and 10 minutes. Okay, and you have a break of 1.5 minutes between each scenarios. Okay, and you also have 2 rest stations. That is, you'll be allowed to take a break. These stations, okay, and basically what you'll check here is how you gather your data. That is how you take your histories, how you perform your physical examination, okay, how you order for investigation, your clinical management skills, as well as your interpersonal skills. These things. So similarly, just like what we had in Mrcp, okay, but not as complex as Mrcp. PLAB clinical skills examination are way easier than Mrcp cases, but still they will expect from you good clinical skills. Okay, so basically they will expect you to have carry out basic physical examination, such as how to examine the abdomen, how to check your heart, chest, and so on. These things will be expected in the stations. At the same time, for both the examination, okay, they will check your practical skills, whether you know it or not, how to check blood pressure, okay, if you can do a venipuncture, if you can give intravenous injections, if you can do a suturing, CPR, okay, these things will be checked in your PLAB 2 examination. See here, interpersonal skills, just like we had communication skills in Mrcp, here will be checked with interpersonal skills. So they will put very good emphasis and assess you whether you are able to explain your diagnosis, your investigations and treatment, okay, your decision-making capabilities, communication with patients relative. These things will be checked widely and in detail. So it's very, very important that you have a very good interpersonal skills. So this was all about PLAB 1 and PLAB 2 examination. Again, I want to repeat that for anyone who are fresh graduates or who have 1 year of experience working in the hospital, your best route to work in the UK is PLAB examination. Okay, many of us from China, okay, have already passed PLAB examination and now working for the NHS in the last 6 months. Now for PLAB, okay, the resources that we have, the book that we use mainly consists of 2000 MCQs. That's called PLAB Digest. Again, you can download this from Google, and this is the only book that is used for PLAB. The online resources you can use is your plabable.com. Okay, you can subscribe to this Plabable and use it. And also, again, I want to repeat, Oxford Handbook of Clinical Medicine is also very helpful for your PLAB examination. Please keep in mind that there is one more resources. It's called PLAB Blueprint. You can download it from the GMC website, PLAB Blueprint, which is also very helpful. So for PLAB 1 examination, you will need PLAB Digest, you will need maybe subscription of Plabable and the PLAB Blueprint. For PLAB 2, do remember, PLAB 2 can be only given in UK. So for that, when you go for the examination, usually most of the candidates, they also book a course in UK, which lasts for 2 to 3 weeks. Okay, such courses will help you to prepare for the practical examination and the clinical examination. One of the most widely courses that people attend in UK are the Samson clinical courses. So usually most of the candidates who appear for part 2 examination, before the examination, they will go early in the UK and they will prepare for 2 weeks with this institute for the PLAB 2 examination. So these are our 2 examination or 2 routes to enter the UK health system. Now, once you have passed Mrcp and once you have passed LAB2, keep that in mind. The next step is to get the registration. Okay, registration from where? From General Medical Council or GMC. Now, in order to get registration from the GMC, you have to prove them with your English language proficiency. So, for Mrcp, okay, you can give the examination of IELTS or OET, Occupational English Test, anytime. For example, you can give it after passing all the 3 steps, or you can give it just before the GMC registration. For IELTS, for GMC registration, they expect you to have 7.5 in total and at least minimum 7 in each band. For OET, GMC will accept a grade of B. So OET is the more easiest form. However, it's much more expensive. Compared to IELTS, OET is expensive but easier. OET will mainly check your medical English. Keep in mind, OET will only check your medical English, unlike IELTS. Now, for PLAB, in order to sit for PLAB 1, you must have any one of these qualifications just before application. Otherwise, you cannot apply for PLAB 1 examination. In order to apply for PLAB 1 examination, you must have IELTS or you must have OET. So this is one disadvantage of PLAB. For Mrcp, there is no such rule that you must have it before. You can have it just before the GMC registration. But for PLAB, you must have one of these before applying for even the PLAB 1 examination. If you have enough fund and if you think you're not so confident of IELTS, you can go for OET examinations. Okay. Okay, now once you have all of these features, the qualification, then you can go for General Medical Council registration. Now for us Chinese graduates, keep in mind that in order to get our degrees and qualification registered with the GMC, we must have to verify our primary medical qualification, that is MBBS. Okay, and that is done by EPIC verification. So if you are sitting idle now in this lockdown, you can do this verification while online, okay, and it's very easy process, but for some universities it can take very long time to respond. For example, those universities who have no idea about such credential verifications, okay, they may not even have accounts and so on. So it may take long times. In some cases, it have even taken 1 year. For me personally, it took 2 days because my university have online system which can verify instantly. So it's very, very easy. So once you get your medical degree verified, second thing that you have to do is your ID verification. And by ID verification, it means your passport, because we will mainly use passport as our ID. You have to verify your ID as well. And now that is verified by something called notary cam. There is a authorized EPIC notary called notary cam, where a notary public will call you in online. They'll have a video chat, see your face and match it with your passport photo, and that's how they will do your ID verification. Please do remember that in some cases this process can take very long, and if it takes long, you may lose potential job opportunity, because now there is plenty of job opportunity in UK. So if you do these things in advance, it will be easier for you to enter the UK health systems. So this is just brief, whatever knowledge I could have given today, I have provided. Now, if you have any questions or any queries, okay, you can ask me, and we can have a interaction now. Let's see if you have any kind of question, you can ask me.
Thank you very much, sir. It was a very nice presentation. Quite briefly, you have covered up all the particulates about Mrcp, PLAB, and also getting the GMC verification. I'd like to now call for queries, questions, if you have any, to
sure.
our presenter, sir. Thank you so much.
Sir, excuse me, sir.
Yes. Yeah, I can hear you.
Sir, I was confused about the syllabus of play. Actually, you just told us about those MCQs stuff.
Okay, syllabus is quite common. Okay, whatever you have studied in your MBBS, okay, basically mostly they will ask for basic questions. However, it will also include how you expect or how you reach to your diagnosis of a case and how would you manage those cases. Not complex clinical cases, but the moderate kind of clinical cases mainly, and not as complex as MRCP. However, that's why I say that you can follow Oxford Handbook of Clinical Medicine or PLAB Digest. These resources will give you an idea and or a hint that what kind of question can come.
Okay, sir.
Anyone else have any queries you can ask?
Sir, one more question from my side, sir.
Yes.
So actually, you two had worked in Taishan, sir. I was wondering if Taishan had that verification stuff.
Okay, Taishan, at the time of my working, I have requested them to start that process. At that time, they didn't have this. Okay, and I was also worried. I instructed them. I don't know if they have started now or not. I'm not sure. You have to talk with them. But I have advised them to do so.
All right, thank you, sir.
Anyone have any question or any queries? Okay, Dr. Ahmed, I think nobody have any questions maybe. Can you hear me?
Excuse me, I would
Yes.
like to ask one question.
Yes, please.
There are separate question banks for PLAB and MRCP in past medicine. So do you think those two question banks will suffice each other in some aspect?
For past medicine, for PLAB, past medicine is not a good choice. People usually don't use past medicine for PLAB. It's PLABable. The site, you can use it, obviously. It's not like that you can't use it at all, but the preferred one is PLABable. That is more appropriate.
I mean, will it help it later on for MRCP as well, or no? They are
for past
totally
medicine
different.
PLAB questions?
Yes.
No, it won't help.
They have separate question banks.
Yeah,
okay.
I know, but that won't help.
Okay, thank you.
There's also a question in the chat box.
Yes.
That how long does it
very good question. Exactly, very good question. Now it depends on your current condition. Okay, or if you are idle, let's say you don't have a job, okay, and you have just graduated, for them 6 months preparation is enough for part 1. Plus, it's very important to remember, once you pass 1, please give part 2 within 3 months. In that case, your work will be less and you don't have to revise everything again. Okay. However, if you give a break and again you start preparing for part 2, you again have to go through all the contents of part 1. So that gets very messed up. Many people will pass part 1 and within the next 2-3 months they will sit for part 2 and they have been very successful. This is the most strategic way to go for Mrcp. Any more questions?
Thank you for the question. Thank you very much for the question and the answer.
Excuse me, would you suggest any courses for MRCP, both online or offline?
No, it's a very big mistake. You are well capable. If you can use these resources, many people are not confident. They will waste money in courses. I personally don't suggest. It's my personal opinion. You can sit in your home, you have a computer, you have internet connection. If you have all the resources, enough. You don't need any guidance. Trust me, those online resources are enough to make you competent for the Mrcp exams. You don't need any course or instructor. those instructor and courses are usually using the same resources from online and giving you as lecture. So they themselves are not giving you anything new. In the meantime, they're taking money from you. So it's not very wise to use any course or instructor.
Would you say something about mocks?
Yes, in all these three resources, especially in past test, that's why past test is very expensive. In past test, they have past exam paper. Other on examination or past medicine do not have this option. But past tests have the past exam papers, which are very helpful because you can check how well you are managing the time. The main problem with MRCP examination is time management. Okay, so because the questions are quite long, 1 page long, and you have 100 of them in 3 hours. So those mocks will prepare you well for the exam day. So it's very, very important.
Will they repeat some of the topics or questions?
Yes. There are around 20% questions or topics that you will see. If you go through the questions, you'll see that, okay, I have already did this so many times. So you will yourself experience the repetition of questions of certain topics.
Thank you so much.
Welcome. Okay, anyone else have any question? We have around 13 to 14 who are attending this. Like, I don't, Dr. Ahmed, do you have any question? If not,
I've got all the answers, but we have a question in the chat box. When will we go through a verification process by
yes.
EPIC? After passing IELTS or OET, or after passing PLAB 2?
Okay, for PLAB examination, if you are doing a PLAB examiner, you can do the verification early as well. It doesn't have to that you have to go for IELTS PLAB 1. Even now, if you don't want to give PLAB or MRCP, you still can give and go for EPIC verification. So it's not that only if you want to give PLAB or if you want to give MRCP, you can do EPIC. For your future, any kind of reference, because AMC also uses EPIC verification. Canada also have EPIC verifications. Australia, Canada, USA. So it's better if you can do it now in advance. Okay, in that way you will save time. It does not have to have no relationship with IELTS or a particular examination.
Excuse me, what are the subspecialties one can go into with MRCP, like oncology and cardiology? What else?
Okay, for MRCP, when you pass MRCP, you will be given options to go into court training. Okay, so you, during that time, then you have to choose from your medicine and allied subjects. Say. So after you complete court training of 2 to 3 years, okay, CT1, CT2, and CT3, after these 3 years you have completed, then you can go for specialization in any subspecialties of medical or allied according to your choice.
Okay, that's internal medicine training for 3 years at the beginning. Okay.
Thank you, sir. I think that's pretty much it with the questions.
Okay.
Sir, I have a question.
Yeah. Someone has a question. Yeah.
Okay.
Assalamu alaikum, sir, and good evening to everyone. I would like to ask that for PLABS 1, like the requirement, there's a clause saying that there's a clause in the GMC website saying that if you did not graduate, you can have a documents or a certificate. Do you know about that? Like document certificate stating that you have during an internship you have graduated, but you have done the graduation exam and cleared everything. As like Chinese universities, they have the graduation.
Yeah, it's called
exam.
provisional certification. Okay, the thing you're talking about is something called provisional. Okay, that your medical college dean will affirm that they expect you to pass this examination. Okay, the same thing goes for USMLE as well, because many people give USMLE Part 1 during their 3rd year of medical school. Okay, but the thing with GMC is that it's very, very important. Keep this in mind that for both MRCP and PLAB, they expect that you must have 12 months of internship. Okay, and this should include 3 months in medicine and allied, 3 months in surgery and allied, and then it goes for obs gynaes and other branches. But you must have a 12 months of internship experience. Otherwise, they will not give you registration.
No, so the question is that due to this pandemic, we had to stop our courses and everything. We were left to do the graduation exam, which is supposed to held during this April, but we are not able to write that because we are in Bangladesh now.
Mhm.
So getting the provisional certificate, what should actually the provisional certificate have in it? Like, actually?
It's just the statement from the dean of the medical school that they expect the student to pass all the examination and to get the degree. The thing is that if you are from a Chinese medical school, have you completed your 5th years of internship yet or not?
Yeah, I did the 5th year pre-intern exams, but the graduation exam is supposed to be in May, so we were not able to write that.
Okay, I'm not talking about graduation exam. The thing that you are calling pre-internship, okay, does it say pre-internship in the certificate, or is it the, typically the Chinese university call it internship actually? I don't know about university. Do they call it pre-internship or internship?
No, the exam which I'm talking about is the exams which are taken before the internship starts.
Okay, so in your university, once you graduate this examination, I mean, you pass this examination, then you start internship. Is it like that? Is it?
Yeah. You pass the pre-internship exam, then you start the internship, and then before the graduation, there's one more exam called the graduation.
Okay, so if that is the case, in that circumstances, okay, you may appeal to GMC because of the pandemic, and you may see their responses. But it is advised that if your university can build up something like that, which states that their student, like you, for example, they expect you to pass this examination, and also they expect you to successfully complete the internship. If they can produce something like this, I think you'll be eligible for part 1 at least. I don't know about part 2 examination, but for part 1 you can be eligible. But keep one thing in mind, that for both of these examination, in later on when you go for GMC registration, they ask for something called GSC. Okay, GSC stands for Good Standing Certificate. Now with the internship in China, you cannot get registration in any registering body like BMDC or MCI or PMDC, for example. So for that to have, you must have internship done in your home country. Otherwise, you will not get registration in your home country. So in order to complete your GMC registration, they will ask for something called Good Standing Certificate. And you can only get this certificate once you have been registered in your home country's council. Otherwise, they will not take it. So it's very, very important to have this Good Standing Certificate. So my advice to you is that discuss this with your dean and see how they approach. At the same time, you can communicate with GMC, explain your situation, that due to pandemic, this has occurred. They're very helpful. They will reply you and advise you accordingly.
Is this is the good standing certificate like character certificate you're talking about?
No. If I could show you an example, okay.
It would be helpful.
I will just show you in the image. I don't know if it can be. Let me know if you can see it in the camera. Okay, I'll try to show you. It's just similar like a license. Okay, for me, as I'm Bangladeshi, we have our medical license as well as the good certificate. I'll just show you. Give me a moment. Okay. Basically, good study certificate states that you haven't done any malpractice while being registered in the council. That is the proof that you have not done any malpractice or there is no complaint against you. That is what is the good standing certificate is. Okay.
So for the registration, we need that when we go for the final after
for GMC registration. Definitely, anyone will not give you registration if you have a history of malpractice, right? Nobody would want to give it. That's why they ask for this. What do you call the good standing certificate? It looks very similar. If you can see here, I don't know if you can see. Can you see?
Yes.
It looks very similar to our license. Okay.
Quite visible.
But do remember that it has only validity of 3 months. Each of these certificates have only validity of 3 months. So only when you are sure about applying, at that time you can apply for it in your council.
Thank you, sir. Thank you. That answers
I have another question.
Yes.
In China, we had one internship before our graduation exam. That internship, I have come back to Bangladesh and did it in my country in a private medical. Later on, I came back after my graduation and did another internship after passing BMDC.
Okay, the internship
So,
you did
will
before
GMC
passing BMDC is not actually internship, first of all.
I can understand, but I would like to ask you if they will check my passport for entry and exit from China, the
Who?
sealed
GMC? No.
pages.
No,
Yes.
no. But they will check what you have done after graduation. You have to give a details of every month what you did, because they very rarely accept any gap. If you have any gap, you should have a proper excuse for that. Let's say, for example, I was busy with pregnancy, I was busy with my wedding, okay, this kind of, or I was busy 1 month holidaying somewhere. This kind of gaps are accepted. But if you have a very long gap, they will ask you to explain. So that's why when you apply, there is a section where you have to explain that every month after graduating till now, when you're applying to GMC, what have you done? So you have to write down in a chronological order, okay, what you are doing and so on.
So visa stamps and exit
No,
entry
those things are not checked.
seals are not checked.
No. It's GMC, not BMDC.
For
BMDC
ID
may
check,
check it. GMC does not check.
yes. For
Okay,
ID
for
check,
ID
something.
For ID check, they just want you to be there in person. Okay, they will give you a proper date. You have to apply in advance in the embassy, and you go there, reach there. They will check your degrees, okay, your internship certificate, your registration certificate. Okay, these things basically that is called ID check. Whether the person who have applied with the certificate is same as you, they will just check this.
Okay.
So I have one more question, if I'm allowed to. So the question is regarding deanery after PLAB 2. Like, how good are the chances of getting a deanery in the UK?
For IMGs?
Yes.
Okay, for IMGs, till now it's not yet clear because things are going to change. As I was telling, Brexit have happened, right? So it's very good chances that things will have a drastic changes. So till now, IMG does have a good prospect about it already, but I don't know in future, because now I'm hearing that any IMGs who have been working in COVID units, even the government is planning to give them citizenships. Okay, so things will change definitely, and Brexit has been a very positive thing for IMGs. So we have to wait and see what happens. Let's see.
I mean, is it easy to get the desired deanery? I mean,
that is what I'm saying. For IMGs, things previously was not so easy, but from the perspective outcomes that is coming out from everywhere, it looks like things will become much easier. That is what I'm trying to say.
Thank you, sir.
Okay, I think I will end the session here today. If you have any more questions, you can post to our groups that we have, the Chinese Medical Graduates Association of Bangladesh. And it's been great to interact in this session. Thank you all for joining. I will end here. Bye-bye.
Thank you so much. Thank you so much for this session.
Thank you.